Using a slider sheet to boost and turn a patient. Use this procedure when the patient can follow commands and participates in the move. Staff should only use minimal physical force. For boosting, raise the bed to the shortest caregiver's hip. If appropriate, tilt the bed into Trendelenburg. Ask the patient to bend their knees, cross their arms and tuck their chin. Count to coordinate the slide.
3, 1, 2.
When you slide, keep your arms in and shift your weight through your legs. For turn-in, shift the patient to the side of the bed.
1, 2, 3.
Cross the patient's leg and arms and hand the sliding sheet to your co-worker.
1, 2, 3.
When moving the patient away from you, weight shift and push through your legs. When pulling the patient towards you, keep your arms in and weight shift back. Position your patient, tuck the slider sheet in, and if applicable, raise the bed rails. For a one-person boost, make sure that the bed rails are up and cue the patient to bend their knees. Stabilize their ankles. The patient pulls through their arms and pushes through their legs. When the patient is able to assist with the turn, raise the bed rail so the patient can reach. Lower the bed so the worker can easily reach over the bed and coordinate the turn. For more information, click on the link in the description.